so sorry. I'm falling apart.
I just ended up in floods of tears and all this emotion overcame me. And
I didn't know how to communicate my emotions. I was so ashamed of the way I felt.
More people are talking about their mental health than ever before, even the royal family.
For me, it was like, don't want to think about it.
Yeah, you have to prioritise your mental health.
But we now know more people are suffering than ever before, especially the young. 1 in 4 struggles with their mental health, and a rising number are developing eating disorders or becoming suicidal. Yet many are not getting the help they seek. In fact, often they're getting turned away. So why is it so hard for young people to access mental health services? Any young person who's suffering can be referred by a teacher or a GP to CAMHS. That's run by the NHS to assess each case and decide on treatment. But the increase in referrals means some areas have raised their bar for symptoms to an alarming level. It's led to some children being rejected despite suffering abuse or having self-harmed. And most shockingly, some seriously mentally ill children have not been offered help unless they threaten to kill themselves. It's estimated 3 in 4 young people with a diagnosable mental health condition don't get access to the support that they need, and nearly 1 in 4 cases referred directly to CAMHS gets turned away. Yet even those who are selected for treatment are still being let down by the system. And that's because there aren't enough psychiatrists, psychologists, and even mental health nurses to keep up with the demand. The NHS staffing crisis means some young people are waiting up to 18 months to start treatment. So their mental health worsens. The more extreme cases see students drop out of school or college, and an increasing number of children develop dangerous ways to cope. Hospital admissions for self-harm have rocketed in recent years, especially among girls. And that's all putting more pressure on inpatient units where beds are often in short supply. Sometimes whole regions in England are left without any specialist beds for children with mental health problems. So they're being transferred to adult wards or sent hundreds of miles away from home. And that is how we know we're in a mental health crisis. The government has a new 10-year plan. That means more funding for facilities and a target to increase staffing levels by 40%. But drastic action is needed. Otherwise, we will remain at crisis point. But don't be deterred. Talking about your mental health is still the best first step to getting help. If you're a child or an adult and need to talk, follow the link under this video to an article which has all the advice on who to contact.